Welcome everyone. Thank you for joining today's virtual Sun session. My name is Caitlin Walker and I'm a part of the marketing team here at Laerdal. Just a little housekeeping before we get started. To ensure you're seeing all speakers, please select Gallery View. If you have any questions during this session, please share them via the Q&A feature that can be found at the bottom of your screen. We will have time at the end for questions. Recordings will be emailed to you after the session is over to watch on demand. Now, I'd like to introduce our Vice President of Sales, Rosie Patterson.
Welcome everyone to our third online simulation user network session. Today, we're going to be learning about simulation on a budget. So as Caitlin mentioned, I'm Rosie Patterson. I'm Vice President for Sales for North America. However, I'm based in Texas, where it's been a balmy triple-digit temperature for the last 2 weeks, so pretty warm here. We're just really glad that you all could be with us this afternoon. I'm very excited at the number of participants. There's over 1,400 people that registered for this session today. As well, they're from the majority from the US and Canada, but we also have participants from Asia and Europe. So technology certainly lets us reach all the way around the world, and we're excited to have such a broad group today. As many of you are aware, we had to cancel our 2020 Sun Conference meeting, which was scheduled to be in Houston, Texas. But that didn't stop us from thinking about innovative ways to deliver content to our customers in a different way. And so through the gracious assistance of our speakers today, we're able to bring you some very exciting content that I think you'll find extremely useful and applicable. And I just want to thank you all for spending your time with us today. We know time is precious and that you're all under a crunch, and we've had to adapt to doing things differently. And for those of you on the front line, we thank you for what you do every day. And so I thank you on behalf of our organization. And with that, I'd like to turn it over to our moderator, Andrew Christopic.
Hi, everyone, and welcome to our virtual Sun session today. I'm here in New York, where we've got a warm, humid day. Thank you, Summer. We appreciate that it's here, and I'd like to welcome all of you. I'd like to encourage you all to use the chat to speak with each other, but to also use the Q&A feature for questions that we will be addressing at the end of this session. We'll try to address as many questions as possible. So again, please use the chat to connect with each other. That's what the Sun's all about, is creating a network for all of you to be able to learn and gain insights from each other. In the Q&A section, please use that for our questions at the end. I'd like to introduce our speakers today, both from the University of Delaware. I'd like to introduce Sarah Beebe, the instructor for the School of Nursing at the University of Delaware, and also Heidi Di Gregario, the Director of Simulation for the University of Delaware. Welcome, everyone.
Thank you.
We're going to be talking today about simulation on a budget and how to do with when you're without. If we were to take a look at the year 2020, there's been so much to do with so much change during 2020. We'd call it the year of the improv, or year at the improv. Everyone's had to improvise, adapt, overcome to go virtual, but they've had to improvise in other ways. So that's one of the many dimensions of simulation on a budget that we're going to be getting into today. So to get everybody flowing here, get everybody's energy flowing, we're going to begin with a polling question. And actually, I'm going to go back in a minute. I advanced ahead, maybe a little too much coffee this morning. So why don't we since we got the polling question up, we're going to do the polling question. That's the way we're going to handle it. So for all of you in the audience, given your knowledge of simulation, do you think that the distinction between simulation fidelity and simulation realism is clear? For me personally, I've always had trouble in this area. It's a bit of a gray area. So given your knowledge of simulation, do you think the distinction between simulation fidelity and simulation realism is clear? We're going to talk about that in a moment. So you have three choices. Yes, I can clearly state the difference between realism and fidelity. No, I find the distinction between realism and fidelity confusing. That's me, by the way. And I'm not answering, or the third choice is I'm not answering until I hear what Sarah and Heidi say. Maybe I, if I wasn't on camera, I would have gone with that. So let's see what the results are. So there you go. I hope I didn't influence everyone. Most of the people said no. I honestly find the distinction between realism and fidelity confusing. And then there's 12% that are just waiting for you both to chime in. So we don't have to back up in terms of the slide, although I thought that was a beautiful photo of the University of Delaware. Tell us a little bit about your SIM program before we advance forward. Sarah, you want to begin with that, or Heidi? Go ahead.
Sure. Yeah, go ahead, Heidi.
Okay. So University of Delaware, if I was to describe what we do best, I would say that we are a multimodal program. Simply that we are not fixed on any one type of delivery, and that we will use multiple types of delivery, types of simulation in order to meet the needs of the students. So we focus really on what we want to teach them, and then we'll look at what type of delivery format for those students will meet that need. And then we expanded to community partners and other disciplines as well. So
yeah, Delaware is pretty unique. We are a fairly large College of Health Sciences, but we're not attached to a hospital or a medical school. So we have a pretty good sized nursing program, but then we also have PT, speech and language, and our simulation program spans across all of those programs. And then actually we even go further. We sometimes collaborate with education and with sports medicine and on all of those. And so it's really kind of cool to see how we can use simulation with groups even outside of healthcare.
Awesome. Thank you. And thanks for doing this while we still have the polling question up. So now I want to come back to the polling question. So given your knowledge of simulation, do you think the distinction between simulation fidelity and simulation realism is clear? Most people said no. Honestly, I find the distinction between realism and fidelity confusing. So the next question is, how can we better define fidelity and real versus realism for people? How can we get it right?
So that's a tricky one, and I'm going to give you the official definition, and then I'll also give you an example. So,
sure.
We go off of the definition that comes from the Society of Simulation, or for Simulation in Healthcare. They have a dictionary, if you didn't know that, that's a free online. But fidelity is the degree to which the simulation replicates the real event and/or workplace. This includes physical, psychological, and environmental elements. Fidelity is the ability of the simulation to reproduce the reactions, interactions, and responses that occur in the real world. Realism is going to sound very similar, is the ability to impart the suspension of disbelief to the learner. So making that learner feel like they're actually there. And so what I like to think of is, you can have high fidelity and very little realism, and you can have a really realistic environment but really low fidelity. So you can have just a bed in a room with a task trainer or a mannequin that doesn't really do anything other than just be a body. But if you add some elements of realism to that environment, you can make those learners feel like they're actually there, even though the patient isn't really a real patient, or they don't actually have vital signs. We're going to go over in a little bit, some ideas of how to do that, but you can make it a realistic environment, but have it be low fidelity, meaning we don't have a lot of technology that we're using. We're not using, some fancy mannequin. And something that's important to keep in mind is that high fidelity does not always translate to better learning. And we have evidence to support that. But we do need an authentic or a realistic environment to be able to increase learning and have an appropriate experience for our learners. So that's really something to keep in mind.
So before we move on, curious, in your experience, where do people tend to go adrift or make maybe their biggest errors? Is it focusing on fidelity when they should be focusing on realism, or the flip side of it?
So I think people get really hung up on, oh, well, I don't have a fancy mannequin. So, how do I make this? How do I work with what I've got? And they're, really focused on that mannequin. Or maybe you get like a donor who wants to donate something, and the first thing people go for is the expensive mannequin because they think, oh, I'm going to be able to do so much with this. Well, a lot of programs don't even know what to do with their mannequin, or they get something that's way above what they need for their program. And so I think there's a lot of focus on the bells and whistles of Fidelity when really it's about creating an environment that the learners feel like they're where they're supposed to be.
Okay, great. So then the next question. So we had talked a little bit about this before, when right before this session started, and it's where do you begin if you want to use low fidelity to make for a high fidelity experience? And I think I'm borrowing something from you, Heidi. The idea of actually you phrase it better. For me, it's going to Michael's, and you mentioned crafts. I forget exactly how you phrase it, but go ahead. How do you phrase it, and the error that tends to occur in this part of planning?
Well, what I mentioned right before we started is that the difference of building fidelity versus thinking about, that I'm just going to go and do some crafts and make it look pretty cool. But so there's a science behind it all. And so it's not really about, going to a craft store and buying, these things. It's really about what Sarah's going to start to talk about is the learner and what do you hope to accomplish.
Yeah. So why don't we go to that? Because it would be very easy to think that, this is about inexpensive moulage, but it's not. So where do people need to begin?
So it's not about the simulator or the moulage. It's about the experience. And what do we want our learners to get out of that experience? The INACSL standards of best practice. So INACSL is the International Nursing Association for Clinical Simulation and Learning. Sorry, I get those all mixed up, but you can go on their website and they have their standards of best practice available. And the biggest takeaway from those standards of best practice often is focusing on what do you want to achieve? So what are your outcomes that you're expecting, and what are your objectives of your learning experience? And so a lot of simulation educators, maybe they only get their students a couple of times a semester, or once a quarter, or wherever you're teaching. And so they think, okay, so I've got to achieve all of these. I got to get them an experience with this, and then we also should probably touch on this, and we could fit that in, and that would be great. That ends up muddying the waters. Really, you should be focusing on no more than about 3 to 4 objectives. And what are the key objectives? What do you want your students to get out of it? Yes, it's fun to have, really exciting backgrounds and mannequins that talk back to you, and, sights and smells and all that kind of stuff. But at the end of the day, it comes down to what do you need your learners to achieve, and what's the objective here? And so, so that's really where you need to start is thinking about that.
And so we're going to get into, before we move forward, maybe you could explain what's going on here in this photo.
Sure. So this is actually a space in our simulation lab. We have a fairly new tower that we have a floor that's devoted to simulation. And so this is actually a wall that's basically like a giant TV screen. And it runs through a computer, and we can put up any picture that we want. So we can put up a picture of an office. I've done it where I've put up the picture of the inside of an ambulance bay. But this is just a classroom that we've now turned into an ER bay or a clinic office. And the only thing that's in there is a little bit of a table and then a stretcher. And so you can do this in lots of classrooms. I mean, most classrooms are set up with some sort of projector that you could put something in the background. Or if you don't even have that, sometimes it's not about the background, but you put, the stretcher with a table that's got, some equipment that you'll definitely need in the room, and maybe you pipe in sounds or something like that to make you feel like you're where you belong.
Sure. So really all you've done, and you could do this with a movie screen, you could do this with posters if you had to, just to project the message that, okay, you're now in a different environment. And you need to dial into that environment.
And it doesn't have to be static. So like you mentioned, if you have a movie screen and you want to do a video, so I did a preschool classroom, and then I put my pediatric mannequin on the floor as if they were having anaphylactic shock or some type of problem. And so there were kids running around, which would be like a busy classroom. And so you can really create almost anything.
Sure,
Mm-hmm.
sure.
Mm-hmm.
So let's move to take a look at some examples, and let's just hover here for a minute, because you had some commentary on it's Laerdal's mom and Natalie,
Yep.
and you wanted to just make a few comments on that. Go ahead, please.
Yeah, so my background is I'm a nurse midwife and a women's health NP, and so I do a lot of OB sims, and I use Mama Natalie a lot. We also have a very fancy, high fidelity mannequin, but there are a lot of times when Mama Natalie meets my objectives, and even better than using a high fidelity mannequin. I have all of my undergrad students, their first birth simulation that they do is just a normal birth. And what I want them to achieve with that is learning how to work with a mother in labor, maybe get her out of bed or change her position or what, things like that. And using a mannequin is not going to help me with that. So using Mama Natalie, which is basically a frontward facing backpack that's cloth with a baby inside and a reservoir for allowing for blood, it makes it totally realistic. The students love it. And I've also taken Mama Natalie out in the field. So I've done a home birth with her. I've done a team birth simulation with a bunch of teenagers that are learning about why they don't want to be pregnant, all of those things. So
it's your Scared Straight program.
Pretty much, yeah.
Okay.
In fact, I even wore Mama Natalie at a conference that I was explaining my teen birth simulation. I wore her around the conference, and everybody was kind of like, "What is happening?" And I'm like, "Yep, see, have belly, will travel. We could do a simulation pretty much anywhere."
I have to say this only because I've taught using Mama Natalie. One of the other things I like about it is a student can wear this and manipulate the baby. So if you're trying to manipulate what goes on during shoulder dystocia, let's say, or even a breech, you're learning while you're having to perform those movements because you're in control of the baby. So thank you for that. Why don't we take a look at, now we're going to go down to something very basic, a basic artifact. So here we have a fetal monitoring strip. Tell us about this.
So like I said, I do a lot of OB sim, and so when you don't have a monitor that you can use, there are monitoring software and stuff like that. This is just a PowerPoint presentation, or this is a Google Doc, where I played a regular fetal monitoring strip. This is a normal fetal monitoring strip. I played that just kind of on a computer screen in the background. So I had a regular classroom, somebody wearing the Mama Natalie. I put this on either a tablet or a computer screen in the background. And then I played a metronome that went about at the rate of a baby's heart rate. And so then now, not only do I have the visual cues that we've got a mom in labor, everything's normal right now according to the fetal monitoring strip and any other assessments that they may need to do, and they're also getting that audio cue that, oh, and the baby's heart rate sounds normal as well. And so you can do that. I give fetal monitoring as an example, but you can do that with cardiac monitoring as well, or any kind of environment where, just adding a little bit of sound really makes a huge difference when you're maybe just using a classroom.
Sure. I'm going to pause just to remind all our audience to please use the Q&A feature for questions. So we do have those logged in for the end, because we are going to reserve time for Q&A. Please reserve the chat simply to chat amongst yourselves. We'll get to your questions, but if you could please confine your questions to the Q&A, that would be super helpful. So let's please look at our next example here. Tell us what we're looking at.
Okay, so what you're looking at is a photograph of repurposed versus brand new primary IV tubing. And so it's important to kind of reiterate, Sarah mentioned that our simulation center is not affiliated with a medical center or a medical institution. So our supplies are for simulation purposes only. So as a result, we know supplies can cost a lot of money, and some people, some academic institutions will they'll either buy new for every experience, which is very costly. Primary IV tubing is about $8.12 per new package. So if you have a few hundred students, that could be very expensive. Or they reuse once it's opened. And so then my question is, does it offer the same learning if it's already been used for the student? And I would have to say probably not, because students then probably don't understand what needs to be sterile and what doesn't. So therefore we started this repurposing program. So just as a, because money kind of speaks volumes. And so $8.12 is what a brand new one costs. To repurpose, it cost us about 4 cents. And that's really just the cost of the sterilization packet that the supplies go in. We recap them so that they look brand new, and then we stick them in this sterilization pouch. We seal it, and so it looks like it's sterile. Students, we'll have maybe up to 300 per semester that we will consume, and that becomes a cost savings of about $2,400 per semester for just primary IV tubing alone. So that's pretty significant.
Outstanding. Let's move to our next example then, because I think the next example is a logical extension of what you're doing here.
Yes. So this is a picture of a repurposed 3 ml syringe and also a brand new 3 ml syringe. Offers the same learning for a student. They open a sterile package. And so what's important here too is that the brand new has sodium chloride in it, because that's how you purchase them. When we'll empty them and then we fill them with sterile water. The sterile water then allows us to use them in mannequins without damage, because we know that the sodium chloride causes a bit of damage. The veins don't last as long. So that's an important thing to note. The 10 ml syringes, which look pretty similar, but they're more costly. So they cost brand new about 25 cents per. To repurpose them, it's about 9 cents. We use about $1,900 per semester, and that gives us about $300+ for our savings. So you add that to the primary IV, and then you've got a good savings there.
Sure. On the previous slide, and we don't have to go back to it, but on the previous slide, there was a sticker, not for human use.
Yes.
And this may sound like a dumb question, but I'll ask it. Is there a standard icon, something that's used in the simulation industry that people should be aware of to mark their products. So if they are,
Yeah.
so that there's no potential for those products to get commingled with product that's going to be used on a live patient.
Exactly. So if your institution ever does donations or they do travel abroad and they take supplies, these would not be ones that you would want to pack because they're clearly not sterile. They have been used and they're for simulation purposes only, and that's why they're labeled as such. Also, if your institution, your academic institution, mentions, or if they're affiliated with a medical center, then that's another reason why that they should be clearly labeled.
Sure, sure.
And so we simulate the label that's on the original packaging with some of the things that would be important for a student to know. And beyond that, we don't add additional information.
Okay, understood. So the next thing we're going to look at, we're going to a wound.
Yes.
And
So
yep, I'll turn it right over to you because you
Okay.
wanted to make a few points about how the syringe actually related to this and irrigation
Sure.
and so forth. So you go right ahead.
Sure. So this is really an embellishment. That's what I call it, an embellishment for either a standardized patient or a embellishment for a mannequin. And basically, what you see down below is a hydrocolloid dressing that has not been altered at all. And then the top picture is one that has been, I purchased a staple gun, which they're available for $10 on Amazon, added a little moulage to it, so that so it looks like an inflamed incision. And then I put a tegaderm over top so that I can reuse this on multiple mannequins or standardized patients. We try not to do that with we don't do that with standardized patients. We'll use a new one if it's touching their skin. But if there isn't anything that's touching their skin, then that's fine.
So what would the learning objective had been here? And you also mentioned that this kind of application has an application in virtual learning because you could zoom right in on something and use this as a very quick prop.
Sure. So virtually, students can then, begin to learn how does an inflamed versus a normal incision look. So you could differentiate the two. But if we were doing a face-to-face simulation, what the learning objective would be for maybe they need to report this to the healthcare provider, their primary care provider, or if they're being asked to remove staples, is this a good time to remove the staple? Is there going to be a chance that the wound is going to open up, that they're going to have a dehiscence or something like that?
Sure.
So it just depends what the scenario is, but students focus a lot on normals. We see a lot on normals when they practice on each other or they're looking at themselves or family members. There's a lot of normals. And so this gives you an opportunity to have an abnormal so that it's kind of broadening their learning.
Excellent. And I'm trying to work in wink, wink, nudge, nudge type of thing.
Yeah.
The learning objectives. No, I mean, for our whole audience, I know it's a point that you wanted to continue to come back to: learning objectives.
Yes. And another learning objective that you might accomplish through this is staple removal. And I mentioned that briefly. Should they, maybe there's a critical thinking piece about the staple removal, but let's say you just did a normal wound and you wanted a student to practice how to remove, and then they can obtain a staple remover, on Amazon for pretty inexpensive, and then they can practice. So
excellent.
Mm-hmm.
Excellent, bravo. So now we're going to look at as we continue the progression, we're going to take a look at what you've done here with a sleeve to rig it up for IV purposes. Go ahead.
Yes, so this is actually just simply a tattoo sleeve. And so it's skin colored. It comes in multiple colors. You can even have it look like, so it's really to cover, if somebody has a tattoo on their arm and they need to cover it because the institution requires that, or they just choose to, they can use that skin tone color to cover over. However, I decided to use it on our standardized patients and or mannequins so that we can have a different learning objective. So I wanted our students to actually assess an IV. That's something that they don't often do. They go and they do medication administration, but they don't often assess the IV, the site. Should I even use that IV before I start? And so this is, again, the hydrocolloid dressings, and they're layered. So it actually feels like it's infiltrated if they were to push on it. And then I did moulage underneath of the 2 layers so that it kind of looks red, but underneath, so it's pretty subtle. And then again, I put Tegaderm. On the other side of the angiocath, I put a reservoir so that it's actually workable. So students can use the IV. And this does help with cleanup with the mannequins too, because then it's not really infusing in them. So if I need a quick, turnover between sims, or it makes it pretty easy.
Sure. Brilliant. It's absolutely outstanding.
And you can use this on a standardized patient. So now you have an IV and your sim for your healthcare, whatever kind of standardized patient.
Excellent. Absolutely outstanding. So now we're going to look at a chest plate where you've put in a central line hole. And there were some reasons behind this, not just to mimic the central line, but you had some other tactics in mind to protect your mannequin and so forth. So tell us about this, please.
Sure. So this is actually an old mannequin chest piece.
Okay.
And so, sometimes when we're upgrading or you're replacing, maybe there's some pieces that you want to save. And not that we, start saving everything, but certainly if you have an objective and there's a way to accomplish that with something that is, again, a low fidelity piece, this might be something that you save. So we drilled a hole, and then we just thread a central line through. And this gives us something that we can use alone. It could be a standalone, or we can add it to an existing mannequin that doesn't have that capability, which is really great. And then we put the reservoir on the inside. Students can dress and undress the central line. And again, we could put a hydrocolloid dressing on there, or just add moulage right to it. And we're not damaging our good mannequins.
Sure. Excellent. Now we're going to see in the next picture, we're going to see a more advanced variant on this. So tell us about this, please.
So this is actually an old skin from an old mannequin. And as we got rid of the old mannequin, and this is a pediatric mannequin, it has zippers on the side. So it's really something that can easily be placed on another mannequin. And so we put the central line. Again, you can see that we moulaged it a little bit. I actually sutured it in so that it has more of that fidelity, because it would be sutured in. And the learning objective here really is central line care. And then we want them to recognize that this central line has some issues. And so there has to be a little bit more critical thinking. And should I be reporting this off to the healthcare provider? Or is it okay if I still use? Additionally, with this piece, I decided we had a simulation that had a gastrostomy tube. It needed a gastrostomy tube, but it needed to be working. So I used, again, drilled a hole, put it through the G tube, and then I have a reservoir on the inside. That way I can actually have our students do the skill of, either doing a feeding or doing medication administration via G tube.
That's brilliant.
Yeah, and the other thing that you see here is a simple ACE wrap. I included that because if you have an existing mannequin that doesn't have gastrostomy tube capability, one way to do that, the ACE wraps are flesh colored, so it doesn't take away from the experience. But pediatric patients oftentimes will wear a belly band with their G tubes. And so I put the hydrocolloid dressing there so that I can simulate some skin. And then I wrap that around the mannequin so that then again, I can have a working gastrostomy tube and that students can really access it.
Excellent. So the next, this one I thought was brilliant. I'm not sure where you managed to find this.
Okay.
We've cut
This is one
off
of
at
our
the top.
COVID-19 creations.
Yeah, tell us about this. I thought this was fantastic.
So this is our latest edition. I call it our latest edition. So it is a clothing mannequin, and they are very inexpensive. They range anywhere from $8.50 a piece to $20 on Amazon, depending. So it really depends where you shop and how long you want to wait to get it. And so I drilled holes. I sutured it in. And so again, the learning objective here is central line care, but I also decided that it would be important maybe that we would have to replicate, some of those task trainers to have a G-tube. And so I drilled a hole there as well. They come as male, female, they come as children. And then you can even get one that it's above the knee. And so they have genitalia, and you can drill a hole and do Foley catheterization or urinary catheterization if you'd like to. So there's a lot of things that you could do. The other thing that is really that you can add to this to add a dimension, if it's part of your learning objective, is for sounds and assessment. So if you have a chest and the patient has a central line and they have some kind of condition, you can certainly put sounds underneath because it is hollow. And then so you can just do it with a smart device and a Bluetooth speaker.
I have to say you're courageous drilling into something. I'm scratching my head wondering what you might have found when you drilled into this, but maybe that's from some bad home improvement experiences in the past. But I really think this is brilliant. So our next question is, at some point you will likely want to fit task trainers of some sort into your program. So how do you incorporate task trainers into these kinds of ideas?
So this one here is, of course, the Mama Natalie, which can be used tabletop, or somebody can wear it. So you can just set it up and have somebody kind of standing behind it. And again, we go back to the objectives.
Sure.
So if the objective of your simulation is just to practice hand skills, which in the OB world, that means, where do your hands go when you're getting a baby out? Then do you really need somebody wearing that belly, or do you just need a belly and a pelvis? This is where Mama Natalie can very easily be turned into, just a task trainer that you can, put a few out on a table and people can be practicing. And then, task trainers, for those of you who don't know what that is, that might be just a body part, or you may have an entire mannequin, but they don't have any vital signs or anything, any higher fidelity things with it. And so, if the purpose of your simulation is to be taking care of a patient who has an infiltrated IV, and you don't have the mannequin, you don't have, you just have an arm, well then, maybe you can use Heidi's idea of, of the sleeve and put that on an arm somewhere, or on a pool noodle or something like that. And now you've got a task trainer, and maybe you've got somebody in another room speaking for that patient, even if you only have the arm available. So there are ways to use task trainers that you don't need the entire mannequin, you don't need the entire all the technology that goes along with a mannequin, but you can still take a task trainer, so just an arm, and maybe you have a baby monitor underneath the arm that's the patient responding to the learner, or you just have somebody standing next to the arm responding for that patient. So it all goes back to, what do you want to achieve? Are you trying to do a big production, or are you just trying to get students to assess a particular area of the body?
And we're going to come back to that in a moment, because when we talk about looking forward in the future, let's just briefly talk for a moment about the benefits. If you were to say, what are the top 3 benefits of using low fidelity equipment and supplies? What do you think they are for the?
Well, obviously cost. So
Sure.
everybody's concerned about that. But also using low fidelity or low cost equipment and supplies allows us to create a setting and a place that might not normally be a sim lab. I do a sim with our EMT students at University of Delaware. We have a volunteer EMT group. They're all students, and they wanted to do a birth simulation. And it's not conducive to their learning to do a birth simulation in a sim lab. They're never going to be in a lab, or never going to be in labor and delivery. They want to get those babies to labor and delivery and see ya, they're out. So what if they have a baby that's born at home or in the back of an ambulance? And so, I was able to use Mama Natalie, and I projected the back of an ambulance bay. In our classroom, we were supposed to have an ambulance, and it got called out at the last minute. So I had to create an ambulance, but they had to work in those confines. We put tape on the floor so they knew where the edges of their ambulance were, and they had to deliver this baby in the back of an ambulance and practice all of those skills. They also actually started at the patient's apartment, and then transferred her to the ambulance in another classroom. And so they had to go through that whole process. That didn't cost me anything. So, except for, the few supplies, which we repurpose, and the Mama Natalie. So, that is a big thing, that you can potentially meet your objectives and your outcomes better using some low cost or lower fidelity items. Then also right now, the big thing is opening our sim labs back up. We are trying to do more with less,
Right.
not necessarily because of cost, but we now have to clean everything, and we have to throw a lot of stuff out because of COVID-19. So thinking about, okay, what do I truly need in this sim that's going to be easy to clean or easy to throw out or easy to repurpose? And so you're going to be taking a lot of stuff out of your sims that you've had in the past, just because they've made that environment more realistic. So that's one thing that's great about low fidelity, is it's easier to clean and easier to flip over and maintain for our COVID-19 concerns.
So that's a good segue. I want to summarize that. You said cost, you said ability to handle all sorts of different locations, and then really the benefits of minimalism right now in today's COVID-19 environment. So let's talk about COVID-19 considerations for just a second.
Okay. So the two big highlights that we've been working on is cleaning, social distancing, and then of course, what happens if we have to offer something distance.
Sure.
And how is that all going to happen? So regarding cleaning, some of these examples that we provided, they can be cleaned. So mannequins generally are cleaned well with alcohol-based cleaners. That's kind of the recommendation. And so all of these things can be cleaned with alcohol. It has the amount of time for contact is not that great. It dries pretty quickly. And so it's, again, easy to clean. Because the investment is not so significant, you can throw them away. And so that makes it kind of nice too. So if you have a student who is COVID positive, they were working in a particular, then it's certainly, you can throw things away if you have to. The other thing with social distancing, so, as we begin to open up, we're looking at spaces that are bigger so that we can still have the same number of students, but they're just spread out more. So we wouldn't necessarily have to have additional faculty. So that's a consideration. So if you have the ability to have space, replicating by using some of these examples, like the clothing mannequin piece, if you're only spending between $8 and $20 in drilling a hole, well, you're using the same amount of central lines, and dressings, you're just going to space them out. And so that is going to be very helpful. Or if you have individual spaces that you can use and not a big space, you can certainly do that as well. And that they can have, I know one institution called it a just-in-time room. So you can have a room where they can kind of facilitate or be facilitated on their own or by a screen, something like that. The other thing with social distancing, or if we are doing a an online format, that if you're doing some type of education or teaching online, that some of these products are really easy to get and cheap, that students can get themselves. And so, or they can be provided. So one example would be, I know some institutions use those pre-packed skills bags, and they have, simulated medication, and they have IVs and things like that. So certainly if they have a pool noodle and a tattoo sleeve that they're using, they can certainly do some of those same IV skills, which is what we did with our students.
Sure.
And that they can do that virtually, and you can see them demonstrate to you what they're doing in a live format. So I think that they're pretty flexible. Not only are they cost savings, but they're something that within this new COVID environment that we can certainly replicate pretty easily and clean pretty easily and still have some of those hands-on experiences.
Excellent. So we've been talking about the low end of the spectrum, but can all this lead to better high fidelity simulation?
Yes. So it all comes down to what are you trying to achieve? And so, there are going to be times that, a $100,000 mannequin is really wonderful. If you're doing a trauma simulation where you've got to do a full resuscitation and you're in an ED bay or something like that. Yeah, it is really great to have an expensive mannequin for that. But for the most part, we don't always need to go high dollar to make it realistic and feel high fidelity. And so maybe you pick and choose where your money is going. Right. So you save on supplies, but you spend a little bit more on something else, but yeah, so it all leads to a higher fidelity experience. And one thing that we haven't mentioned yet that really goes along with all of this is setting the stage for your learners and then debriefing afterwards. Right. So we've got our objectives, we've got our outcomes. Sometimes your learners are going to be walking into a room that, maybe doesn't look perfectly like a hospital room. And so you need to do a pre-briefing, and that's in the standards of best practice as well, to kind of talk through, okay, so this is what's going to be totally real, and then this, you might have to approach this part of your simulation a little differently. So you may say, yes, you're going to be able to get full vital signs on this patient, or, this patient doesn't have actual vital signs, so you're going to be looking to the screen for your vital signs or something like that. But you need to let your learners know what they're walking into and what's going to be real and what's not. And, we all have this feeling like, oh, well, let me just see if they notice this, let me see if I can trick them. And the evidence does not support that. It's actually better if you tell your students more and prepare them more walking into a room with mannequins, lower that cognitive load a little bit, so then they can really focus on those objectives and what they're supposed to be achieving. Somebody just posted in the Sun group this week a really great article about cognitive load that I recommend everybody go see. But then you need to debrief afterwards. So, okay, how did you feel about that? And maybe you need to piece things together, that if the learners felt like, oh, this really didn't seem realistic, they can still learn from it, even if maybe when they were in the sim, they didn't feel like they were learning from it, if you talk through it in an appropriate way using a good debriefing strategy. So I want to be sure that we mention that those are really, really key to a good simulation too.
Excellent. In the interest of time, I'm going to make a command decision here and suggest that we skip our polling question, because I want to get to audience questions, and we have 107 of them. So this will be interesting. But let's just to start to finish things off. What should how should we look at simulation going forward
Okay.
when we're focusing on simulation on a budget?
So really, this is kind of a recap, and to really think about what is it that you hope to accomplish within your experience. So for your students, so your learning objective and the outcome. What is it that you are trying to do? And then if, and we recommend, because best practice is to use some type of simulation template so that you have your information so that it's reproducible and that you can update it. So if you're using a template, and then they generally ask you to limit to 3 to 4 learning objectives so that you're really not muddying the water and causing, as Sarah said, more of this cognitive load, that you're really streamlined on what it is that I hope to accomplish with my students, what I want them to learn. So more is not always better, and that you want to really keep it simple. You think about the standards of best practice for simulation, and I think if you think about it in the development part, then when you've created something, you don't have to go back and say, oh, how does this fall through that filter? And so that's really important, that if you develop it with all of that in mind. So, simply, am I looking for a formative experience? Is this a summative experience? What is it that I'm trying to do? And then you strategize about how you're going to do that. And I think one of the big pieces here when we're talking about simulation on a budget is cost of consideration.
Sure.
And generally it is. Cost is a consideration. And then how about space? Do I have a lot of space? Do I have flexibility? Do I need to have something that I can use for multiple purposes, like some of these things that we've suggested? And then, do I want to introduce a new concept, like an abnormal assessment? What about wear and tear for my mannequins? Is there a way that I can eliminate some of the wear and tear on my mannequin that I have, that I've really invested in, so that it has longevity? So that would be another consideration. And that's one of the reasons why we did IVs that were external with the IV sleeve, so that we don't have as much wear and tear, and we can flip them very quickly in between experiences.
Roger that. So last but not least, and I think this is intriguing, extending how you're applying, how do you apply this type of thinking ultimately to high fidelity? So I really like the idea of the minimalist thinking, and beginning, rather than getting way ahead of yourself, really starting with what can I do with, and what can I do without, and then working up. You had some comments on this, Sarah, or maybe Heidi, you wanted to take it, but what are your thoughts about applying everything we've talked about today to high fidelity?
So really, it's two sides to the same coin. And really, in our institution, what we focus on is scaffolding our education. Don't make it so complex that the students don't feel like they can be successful. So as we said, simple is better. And we start with those simple skills, perhaps, that you want them to learn. But then those are great to insert into or integrate into an immersive experience. And so then you have Nursing Ann, the Nursing Ann simulator. So you could have Nursing Ann, and then you have a Nursing Ann simulator. So it's a great trajectory for students to begin to build, and they build some confidence as they go. And then you have this immersive experience with, probably more cognitive load, but that they're developing in their program, and they need more cognitive load because that's what the real clinical experience is going to be like anyway. So you've come alongside them early, and then they have this immersive experience. And when we do our immersive experiences, we have a term that we use, that it's an ability, or it's an environment in which you can fall forward. Our students know that it's a safe environment to make mistakes. And they can certainly, we're going to debrief that, we're going to discuss it, and that they can fall forward. And so, one example is we use a central line task trainer. simple. And then we progress it forward and then we have the nursing and it's an immersive experience. And perhaps maybe the student even has 2 human patient simulators that they need to learn, because part of their learning objective is to prioritize between 2 patients. And how do I do that? Well, you can't do that unless you have 2 patients. So then we have 2 human patient simulators, and it's a safe environment for them to figure that out.
Very good. So I'm going to transition us over to audience questions. And I can only say it won't be possible to get to all 115. We really apologize for that. However, we are going to invite everybody to join the Laerdal Sun Facebook group. You'll receive information about that because Sarah will be available. She's a member of that group, and she'll be available to answer any of the questions that we don't answer today, and we will figure out a way to get all these questions answered. But one question right out of the gate that I see has come in numerous times is, where do people get the packaging for the IVs? That seems to be a real
It's all about where did you get these things?
Yeah, yeah.
That's an easy answer for most of them.
Yes, so these sterilization pouches are the same that they would use in a physician's office who does, they have an autoclaver, and they're very cheap. So the smaller ones are 4 cents, the larger ones are 9 cents, and you can get them on Amazon. Or if you have a relationship with some type of medical distribution company like Medline or something, it's not a plug for Medline, but certainly you can get them there too. They come in numerous sizes, so we put lots of things in them. We buy non-sterile bandages, and you can put them in a little sterile container, so you save money that way by not buying them sterile. 4x4s, 2x2s, whatever it is. And somebody just put in the chat that they bought them on Amazon. I think they're a little more expensive on Amazon, but you can certainly buy them on Amazon. And so,
yeah, a lot of our stuff, I see that there are a lot of questions. A lot of our stuff either comes from Amazon or from, a medical supply company.
Right.
Some things we've also gotten on eBay, like equipment and stuff like that. We've found on eBay, maybe even equipment that doesn't work, but you just need it for simulation purposes.
Sure. I'm going to help with just a few questions that have come in. Scenarios. Laerdal can help you with that. There's been a few people asking about labor and delivery scenarios. You'll receive follow-up from us after this webinar, and if you'd like someone from Laerdal to reach out to you, we can help you with the scenarios. We can help you with Mama Natalie. We can help you with Nursing and Simulator. I didn't intend to give that plug, but it's going to save that information is going to save people, I think, if they just want to ask for Laerdal's help. And if you have some additional resources to offer, feel free, by all means, Sarah and Heidi.
Well, there are a couple textbooks out there too. I don't know how many people in the audience are advanced practice, but there is a new textbook that just came out this spring that is for advanced practice nurses, and it has simulations in it. And they follow all of there you go.
I was holding my computer up, but here it is.
So that's one. And then there are some for undergraduates as well.
Very good. So we've unfortunately run out of time, and we will figure out a way to get these other questions answered for you, either through the Facebook group or through some other means. So thank you for just the wonderful chat we've seen going back and forth to all our listeners, the great Q&A. I want to just call everyone's attention to some resources from Laerdal, our COVID-19 resource center at laerdal.com, coronavirus. You've got information on future suns. We have another sun, virtual sun coming up on the 29th, which we hope everyone will attend. Please join our Sun Facebook community. by first going to our Facebook page and then registering for the Sun group at /Laerdal Sun at the Facebook group. And then also, please register for our content. We produce an awful lot of content that's meant to help all our clients do better simulation. Please sign up to receive that content as we produce it. So, thank you both. Sarah, Heidi, you've been awesome. We probably could have extended this for another half hour easily. It's been great watching the chat. People have truly enjoyed it. So thank you very much for being with us, and to our audience today, thank you for joining us. We certainly appreciate what you do.
Thanks for having us.
Yeah, thank you. And if people have questions, they can find Heidi and I both on LinkedIn. I'm on Facebook and also on Twitter, and my handle across all of them is @SimSarahB. So it's pretty easy to find.
Very good. Thanks, everyone. Very much appreciate it. Have a great day.